Welcome, everyone, to our last High Five episode of 2025. I'm Lauren Ripplinger, Chief Public Policy and Impact Officer for AHIMA. Joining me today for our last episode of the year is Kate McFadgen, our Senior Director of Government Affairs for AHIMA, and Andrew Tomlinson, Senior Director of Regulatory and International Affairs. Thank you both for being here today. Kate, I'd love to start off with you and talk about a little bit on the congressional side. What do we have left? We have 2 weeks left in the congressional calendar. What does Congress need to get done before the year end?
Yeah, that's a great question, especially considering that we are just coming out of a government shutdown that was the longest government shutdown that we have ever seen, especially considering that it was a full government shutdown and not a partial one. So Congress is just coming off of being out for over 40 days and then coming back to really, a crunch time at the end of the year. So one of the things that got us out of the shutdown was a compromise between some Senate Democrats and Senate Republicans that the government would be funded through January 30th with an agreement that there would be a vote on an extension of the ACA subsidies by the end of the year. So Democrats were really sort of hanging their shutdown requests on these ACA subsidy extensions that expire at the end of the year. So Leader Thune agreed to this vote. So what is going on right now is Republicans are really looking at, can they figure out a healthcare plan to put up alongside a vote on ACA subsidy extensions to sort of give another option for Republicans to vote for if they don't want to vote for these ACA extensions. So right now, they have not really coalesced around any particular plan. There are some thoughts on increasing the ways HSAs can be used. There's some talk about tax changes, maybe some tax refunds for money spent on healthcare that can be put in a healthcare plan. But right now, Republicans have not coalesced around any one plan to put up, whereas the vote on these extensions is supposed to take place by the end of the year. So we're really sort of figuring out what's going to happen with that. A lot of Republicans are hesitant to vote for any ACA extenders, while others are really worried about the midterms next year and figuring out if these extensions expire at the end of the year, healthcare costs go way up. Is that going to impact midterm elections, especially for Republicans already going into a tough midterm year when, often in a first or a term for a president, the midterm elections loses votes for the president's party. So it's really figuring out what the plan is going into the end of the year, along with beginning that work on the federal budget that is set to expire towards the beginning of next year, and figuring out, are we going into another shutdown or is there another plan coming up?
So, Kate, you mentioned midterm elections. As of today, we are officially 335 days until the midterms. No, not that we're counting or anything like that. But what do you foresee as the big health IT or health information topics that Congress may tackle next year?
Absolutely. So, looking to the very beginning of the year, as I mentioned, federal funding lasts through January 30th. So beginning of the year, it's really going to be about, can they pass the rest of the federal appropriations bills that fund the government. So far, they have gotten top line agreements on most of the appropriations bills. However, they are missing two, and that includes the Labor, Health and Human Services, Education and Related Agencies Bill, or Labor HHS Bill, which of course is the big, healthcare provisions. So they have still not gotten to an agreement on that. So that is going to probably take up a lot of January. We may see some appropriations bills pass in January, and we may see another continuing resolution for, some of the unfinished appropriations bills. They may get it all done. If they don't, of course, we could go into another shutdown. This time it would be a partial shutdown. But that's really what January is going to be focused on in Congress. looking forward in Congress, of course, next year is going to be a shortened calendar because of the midterm elections. So there's just not as much time to get things done. Healthcare will still continue to be a big priority. Even if they sort of get these extenders done by the end of the year, I think that healthcare coverage and prices will continue to be a big topic going into the midterm election. So we may see a larger healthcare package next year that could sort of pull together a lot of different topics. One thing that I think we are going to see more movement on is privacy. So, of course, Senator Cassidy, who is the chair of the Health Committee, recently released a privacy bill really focused on non-HIPAA covered healthcare entities. So looking at sort of, will there be movement on that bill? The Energy and Commerce Committee earlier this year sort of pulled together an RFI on what a privacy bill might look like going forward. So we might see some movement on the House side as well. So I think that's going to be one sort of big topic that comes up. Telehealth, of course, is another ever-present topic. The telehealth extensions that were first put in with COVID were extended through January 30th with the federal budget, but then, of course, those expire again. So AHIMA, along with a number of other organizations, really hundreds in DC, are really pushing for those extensions to be extended much longer or made permanent. So continuing to look at telehealth next year, I think will be a high priority as well.
And is it fair to say that as we get closer to the midterms, we can anticipate more politically driven vote taking on both sides of the aisle in order to put people on the spot?
Definitely. You will see a lot of votes being put up to really drive these election campaigns. So you will see some Republicans, not wanting to take votes on anything dealing with the ACA. Some might want to say, well, we voted for these extensions, to make sure that healthcare was affordable. You will see Democrats really honing in on any healthcare votes that Republicans do or don't take and making those staples within their own campaigns. So the majority party and the president's party is usually sort of on the defensive, with what they have done, haven't done in their term. So Democrats will definitely be looking to sort of highlight, what they see as Republicans' failings. Republicans, will of course be looking to run on some of the things that they have gotten done, the reconciliation bills, if they do get a healthcare package together. So it will definitely be a much more political time, and I think we will see the work calendar be even shorter than it looks like on paper, just because a lot of the work will be wrapped up early in the year as they go on the campaign trail.
Excellent. Thanks, Kate. Andrew, I want to shift gears and talk about the regulatory side. From a regulatory perspective, what does this administration need or hope to get done before we close out 2025?
Yeah, that's a tough question in terms of what exactly we're going to see before the end of the year. As Kate had covered, there was such a long shutdown and they can be quite disruptive. We know that it's disruptive for a lot of the programs that people and what our focus in AHIMA's case, many of the providers rely on and patients rely on to receive and deliver healthcare. It also is incredibly disruptive to the policymaking process within the federal government itself. If you think about the way that different requirements are stacked within the review and release process within the Office of Management and Budget, who reviews it for legal compliance as well as alignment with the White House and some of their policy priorities as well. Sometimes what they may think over time for the year is, okay, we have these statutory requirements in these months with these weeks, it gives us this runway to review, respond, and release. And so we'll slot these non-required rules or rules that maybe don't have statutory requirements. So we'll think about things like the inpatient prospective payment system rule or the physician fee schedule rule or the outpatient prospective payment system rule. Those all have deadlines for when they have to be released within the year. So if you might think about something like the Assistant Secretary for Technology Policy / Office of National Coordinator, so ASTP ONC's, the regulatory rule that we think we might see in December. It was originally planned to come out in November. Where it is now as it relates to hitting the right cadence between statutory required rules and rules that there are now policy priorities that want to go out, it's a little unclear. That is one thing I think we are expecting by the end of the year, I think hopefully, is to get a look at least what that deregulatory rule will be from ASTP ONC. If not, that'll roll over into the next year. Within it, we're expecting some shifts in there as it relates to some of the transparency rules that require different pieces of data that need to be presented to the provider when utilizing artificial intelligence. That's the decision support intervention, or DSI, requirements. Maybe some changes to information blocking, as well as the trusted exchange framework and common agreement requirements that were put in through that HTI 1, 2, 3, and ultimately the 4 process. That's the other thing that we are waiting on. There was originally HTI 1 and HTI 2 that was proposed, and then they've broken out HTI 2 into now 3 separate final rules. They tucked HTI 4 into the inpatient prospective payment system rule. We expected 5 to go in with the fee schedule, but with the shutdown and the delay, there's a chance that wasn't in there. So we are waiting for that. They may be looking for a vehicle to ride along on there. That's what we're waiting on from the information or the interoperability side, the health technology side. From a privacy side, OCR just recently announced that they are going to be providing some guidance as it relates to the security rule. We're going to wait, and they did a call for comment on what exactly do they want in that guidance. We're going to see, maybe we see that guidance before the end of the year. Maybe they're at the early stages. It's hard to know from there. So I think right now, a lot of what we're looking for as we kind of wrap up 2025 is just what was planned for the end of the year. Will it still hit by the end of the year, or are we expecting to see it now roll over into the 26 timeline? And we'll just kind of pick it up from there.
Excellent. Thanks, Andrew. Looking back, it's definitely been a busy year in terms of healthcare policy with this administration, where a number of different initiatives were announced. What do you see as the key regulatory priorities for this administration in the health information, health IT space for 2026?
Let's start with, I think, the biggest one, and then we'll talk about some of the other sort of ancillary policies or technologies surround healthcare as a whole. And that is that CMS interoperability framework, the CMS aligned networks. I mean, it's been now almost 20 years, over 20 years since the White House originally created ONC as a small, non-appropriated office that was looking at interoperability and information technology used within healthcare, that then led to it being codified as the Office of National Coordinator underneath then President Bush. It's been a long time since we've seen health IT issues make it to the White House stage. And we did see that last year with a White House event, the Make Health Tech Great Again event, that did feature the president making remarks on interoperability. We're recording this on the 3rd. There was a cabinet meeting earlier this week in which those conversations happened again with the Secretary Robert F. Kennedy Jr., talking about patient data access and access to records in that cabinet meeting to the president with the press present. So that is, I think, the biggest issue that we're going to see coming out from 2025 that will roll over into 26 is the continued build on that CMS interoperability framework. Part of that framework does have a pledge in there that has different categories of individuals engaged in the health information technology ecosystem, pledging to do certain things, whether that's making data more available from a provider perspective and sharing it, or from app companies making it easier for patients to be able to access their data and move them into things like artificial intelligence or utilizing tools to eliminate the need to sign the same forms every time. That's their Kill the Clipboard initiative, to networks furthering some of the things that were created as part of the Trusted Exchange Framework and Common Agreement, to engaging in additional access and making sure that data is accessible to those apps and those patients where they want it, and moving forward. Those first set of deadlines underneath those pledges hit, I think it's like the January to March timeframe, and then there's a second set that hit in the summer timeframe around in there. And so I expect that to be a big key focus of something that's going to roll over from 25 into 26. Dr. Oz has very much said that he wants to overlay technology through everything that CMS does. as part of his role as the CMS administrator. They did just announce the new access model as well, continuing some of that work with technology. Outside of just all of that work that's happening, and I think a really key focus of this health portfolio for this administration is some of the work on artificial intelligence. There was a rumored executive order we may see as it relates to artificial intelligence at the end of November, early December. Sounds like maybe some of the different technology groups that are engaged in that have gotten into the White House, and we might not necessarily see that now. It may return in the future, but there is a clear focus on both creating more opportunity for artificial intelligence, but also removing regulatory barriers to innovation relating that. They did do the Office of Science and Technology Policy request for information on removing those regulatory barriers to innovation in AI. And so I imagine we'll see whatever rulemaking relates to that will come out of that RFI, whether it's from NIST or Labor or Commerce or HHS or something in next, the next rulemaking cycle in next year. And I do expect the National Institute of Standards and Technology to continue their work of what they're doing on leading the AI charge nationally and creating some of those best practices and standards as it relates to the use of AI. The last piece that's just kind of hanging out there at this point, it's kind of odd. It started under the first Trump administration, works through the second one. Now it's back a little bit of some of that privacy and security work. There are two different HIPAA rules that are on the regulatory agenda for the spring in May. Now, I will caveat it and say that May is kind of I don't know, I guess we have to put it on here. So let's put May kind of date as it relates to regulatory agendas. So once we get the fall agenda, you get the fall agenda in the spring agenda in the fall. We'll see if it's still the May timeframe or the fall one. But the privacy rule that was released at the end of the Trump administration, the first Trump administration, is scheduled for May. And then the security rule that was also released at the end of the Biden-Harris administration is set for May as well. We'll see if we get a combined rule or separate rules related to that. And so those are kind of the three areas that I'd expect this administration to be active is continuing that work on the aligned networks, the AI piece, and then whatever a new modernized HIPAA might look like.
And Andrew, you mentioned the draft executive order. For our listeners who may not be following that as closely, what was really kind of the content and context of that executive order as it currently sits, or draft executive order, I should say?
Yeah, I think we're still waiting for some of, we've seen some draft text around it. A lot of it was around trying to reduce some of the directing the different agency heads. Remember, an executive order, I know you know this, Lauren and Kate and whatnot, for those listening, executive orders don't carry rule of law. They're really just to kind of you're putting your flag in the ground to say, this is what we're going to do. And I'm directing the agency heads to do this. And they were really directed to look at, burdensome is not really the right word, but yeah, I think we'll just use it for the sake of the conversation. Overly burdensome, whether they're state laws or other regulations that are in place, and trying to find avenues to remove those that would potentially have a different outlook as it relates to how AI may be regulated or enabled from a policymaking perspective. The draft had directions for DOJ to look at those different state laws and things like that, and then also directed many of the other agency heads to review their own laws or their own regulations or policies that are in place to see if there's any that they can pare down and remove from there. So a lot of that, and I think that's where some of the controversy came from, is if you think about some of these spaces, on the surface, you may think, well, regulation, everybody no one wants to be regulated because it makes it harder for them to work. But it's sometimes counter the space. Regulation gives them guardrails. It helps make some companies that are working on different products, makes them seem more legitimate is not necessarily the right word, but something that you can more be trusted because it's operating within a box. And so you may find that some, different interest groups may say, well, wait a minute, we don't want these rules taken away. We want guidance because that gives us an understanding of how to move forward. And it's not just this wild west of everyone working within there. So that's kind of where the controversy of it came, what the contents of it was. And then we'll see if it ends up coming to light in the future.
Excellent. Thanks, Andrew. Appreciate that additional context.
Yeah.
So I'd love to ask you both this final question, and that is, as we move into next year, what are going to be some of AHIMA's key policy priorities for 2026? Kate, let's start with you.
Great. Yeah. So looking at 2026, AHIMA is really continuing our work on the Hill with patient misidentification, focused on, of course, the repeal of Section 510, which is the ban on a unique patient identifier that we have historically supported, but also really looking at the Match It Act that we introduced for the first time in 2024 and then was reintroduced in this Congress. So really working on increasing support, co-sponsors, education around that bill. And that bill would, of course, do a number of different things, but really improve standards and definitions within programs that already exist to really improve patient matching and make sure that patients are accurately matched with their health information. So we have worked with our champions on the Hill, Representatives Mike Kelly and Bill Foster, for a number of years on these issues, and we're excited to reintroduce the bill earlier this year. So as we will be continuing in the same 119th Congress next year, the bill remains introduced. And so we're really working on increasing the number of those co-sponsors, getting more endorsements for those bills, making sure that Congress is educated on the issue of patient misidentification and what can be done to solve it. And of course, working with our partners in the Patient ID Now Coalition to really push forward that work. Another issue that AHIMA is really highlighting on the Hill is AI, and especially its impact on the health information workforce and what that might mean sort of going forward for the management of patients' health data, what it means for the workforce, whether we need upskilling, whether we need different solutions, looking at is AI helpful in certain contexts? Is it unhelpful in certain contexts? Which tools are really appropriate to use, and making sure that we get the research and data necessary for Congress to look at these issues and then to really support our own membership in its use and increased adoption of AI. So AI in the workforce, of course, is always going to be some of our top priorities going into next year as well.
And Kate, for our listeners who may be AHIMA members, there's actually a chance for them and an opportunity next year to come to Washington to advocate on behalf of those two key issues. Can you say more about that?
Absolutely. So we are excited that our advocacy summit is going to be in Washington, D.C. again next year. It is going to be March 16th and 17th. So Advocacy Summit is a 2-day event, with the first day being an education day, what we call our Policy Institute, where you hear from policymakers, members of the administration, or staffers on the Hill, policy experts within DC about what's going on in the health IT space, and making sure that we get our members that education. And then day 2 is for AHIMA members to go to Capitol Hill to advocate to their members of Congress and their staff about these issues that we are really prioritizing in 2026. So registration is open now. We really hope that everyone registers and is able to come, but make sure to register early because we did sell out last year. So always good to get your name in there early.
Excellent. Thanks, Kate. Andrew, from your perspective, what are some of our key policy priorities we're going to focus in on the regulatory side?
Yeah, I think a lot of what we talked about from what's rolling over from 25 to 26 are going to be the avenues for us to talk about these things. But the administration has said that they're going to begin enforcing information blocking. And I think that's one of our areas that we're going to be focused on, working whether it's within AHIMA or with some of our coalition partners, including within our Health IT End Users Alliance that we co-lead with many other organizations. Trying to look to make sure that the education is out there and that the space is ready for whatever changes may be coming to information blocking, or also what questions may be remaining as it relates to how to comply with information blocking. The other thing I didn't mention is the agency priority, but something that we're actively working on and will continue to be engaged in is the electronic prior authorization work. Those deadlines are coming up for the technology at the beginning of 27. It's hard to believe that we're already there. And so we'll be working actively with our partners, both within the HHS and outside of it, to make sure that the different pieces are in place to make sure that electronic prior authorization can be successful when we do move to the implementation stage. In addition to those kind of two ancillary long-running pieces of it, we are going to continue engaging with the administration within the both Office of the Secretary and the Centers for Medicare and Medicaid Services, and finding avenues for us to be able to make sure that the HI profession is brought forward in many of the conversations they're having on what a new digital ecosystem may look like. We had opportunities in 25 to engage with policy leaders within the administration, like Amy Gleason, who's leading as the acting DOJ director, but also leading much of the health technology ecosystem work within CMS and HHS as well, finding more avenues to make sure that we can get the HI professional perspective in front of those leaders is going to be part of our policy priorities for next year. Kate did mention workforce. I don't want us to not talk about that as well. There have been a number of different initiatives announced out of the White House and then continued through both Commerce, the Department of Labor, and Department of Education. And that is something we are continuing to watch to make sure there are opportunities for us to capitalize on, whether it's new education opportunities related to artificial intelligence, or the way in which we are using technology in a different space across the country as the workforce develops, making sure that the HI profession is included in that work, but also has an opportunity to capitalize on it if there is that chance there. So we expect it to be a busy year next year, and then we'll see if we get the HIPAA rules, of course, and see whether or not there is HIPAA privacy and security opportunities for us to continue those conversations that we've been so active in on the last several years as well.
So needless to say, we will have a busy regulatory schedule in 26, as well as a legislative calendar. Is that a fair assessment for both of you?
Yes.
Definitely.
Excellent. Wonderful. Well, Kate and Andrew, I so appreciate you all always sharing your insights and what's been happening in Washington. And I know our listeners do as well. I want to thank you both for being here and thank our audience for continuing to be a part of these conversations. We look forward to sharing more episodes in 2026, and happy holidays to you all.